ICARE is a philosophy about really creating patient relationships. And it's a concept of taking care of not only our patients, but each other.
When our patients come to see us, they already are seeking help. That's a given. But we can provide them more than just help. We can provide them with an experience, a connection, a sense that they are really valued as human beings.
Thank you for calling Sutter Urgent Care. This is Mike. How can I help you?
Introduction to me involves both me as a provider introducing myself, but also hearing how the person likes to be addressed. For instance, my name is Jennifer Alt. The only one that calls me Jennifer is my mother. So I like it when physicians or providers ask me what I'd like to be called, because it's Jen and it's more personable.
Hi, good afternoon. My name is Maurice. How can I help you?
Hi, yes. I have an appointment at 2 o'clock.
2 o'clock?
Going to the physician is intimidating for many individuals, especially me. It is something that I worry about, and I'm nervous of going. That introduction is almost like an icebreaker. It calms me down.
Hi, my dear 6-week postpartum.
Good
Hello,
to see
welcome.
you.
And who do we have here?
This is my mom, Millie.
Hi, super grandma. Very nice to meet you.
And baby Joshua.
In my practice of pediatrics, we sometimes have family members come in. And part of my work now is to introduce myself to every member of that family, because sometimes you don't know who's in the room.
It's a beautiful day we're having today, isn't it?
Yes, it is.
Okay, and your first name?
The little bit of effort it takes to reach out to the other individual and make a connection will come back to you 10 times over. The little things make such a huge difference.
Hi, my name is Karen. I'm Dr. Ward's medical assistant.
Hi, nice to meet you.
Nice to meet you too. We'll be right this way.
Okay.
How are you today? I'm doing good.
I usually sit at eye level. I try to make eye contact. These things really show that you're trying to connect with the patient. And I think the same is true with all my colleagues, is, the importance of being focused only on them and looking at them and addressing what their needs and concerns are.
Thank you both for being here today. Before we get started, let's go ahead and introduce ourselves.
Hello, I'm Carrie.
Hi, Carrie, and I'm Maurice.
And my name is Callaway. So the reason that we're here today...
So what brings you in today?
Well, I've been having this persistent cough and I'm getting a little concerned.
ICARE to me means really helping the patients feel heard. What are your concerns today? How can I help you? And then to allow them to speak and only ask clarifying questions. Don't interrupt otherwise.
So part of this visit is also making sure that you are where you need to be in terms of your emotions and support. Obviously, you have super grandma here, but how are you feeling overall?
I feel pretty good. Yeah.
When I first moved here, I started seeing a nurse practitioner, and I just remember when I walked out of the appointment, I just felt like, wow, I feel really good about myself. I feel really good about the person who I just interacted with. I think the thing that the person did to make me feel good was really listening to me, really looking in the eye and explaining things to me, asking me questions, and then giving me some suggestions for things that I want to work on.
I think if you take those moments to look me into the eye and communicate, it will actually help with me maybe not calling 5 times or emailing 6 times. So that initial investment for a patient is actually helpful for not only the patient, but for probably the medical staff.
What we do each and every day that's very routine to us can be very intimidating to them. So that concept of reassure definitely comes in 2 separate messages. One, the concept of I'm doing something, I'm going to ask your permission, I'm going to tell you what I'm going to do, so that they get comforted by knowing ahead of time. The other part of it is people are anxious. What they want to know is this normal? Is this not normal? So being able to do every part of the exam and letting them know, here's what I found, here's what is concerning, here's what's not concerning.
So full head-to-toe exam looks like you're healing well. And at this point, we could say you're safe to resume all your normal activity.
I always ask patients for permission before I do anything to them. And I often ask permission if I'm going to ask someone to do something who's a colleague. I, in pain management, also see patients with post-traumatic stress syndrome. And if you touch these patients, it really is distressing for them, and they can have a startle response. It's incredibly useful to ask for permission.
All right, so I have you all set to see Dr. Ward for today at 2 o'clock.
All right, thank you.
You're welcome. Have a great day.
Have a great day.
Thank you.
Exit is as almost key as the introduction. Really, for a patient like me, who is nervous, who again is apprehensive of being there, the exit should be a brief, quick summary of what we discussed, and then say, hey, your next visit is on such and such date.
We would plan on seeing you for your routine annual exam sometime in the next year, but obviously if you need to see us sooner for any urgent visits or any concerns, please let us know. Before I let you go, what questions do you have today?
Just yesterday, I was on the phone with a patient who had a concern that she wanted to share with me. And I said, okay, so this is what I'm hearing from you. This happened and this happened. And really what you care about is this. And she's like, that's exactly what I'm trying to say.
Okay, so Dr. Stenner should be with you in about 5 minutes. If you need anything else, I'll just be right outside the door.
Thank you very much. I appreciate it.
All right, thank you.
The thing I like to exit with is hope. So I like to exit giving the patient a feeling of hope, like I can manage this problem that I'm having, or the thing that I'm working on is going to get better.
I think it's hugely significant that ICARE was designed by us because it is us. It's not somebody from the outside dropping it in. It's our own staff, our own clinicians, all coming together to really define what is ICARE.
I think we have a great culture here. There's really a kindness and empathy, a connection with patients. And what we're trying to do with ICARE is really take that to the next level.
If everyone follows the acronym of ICARE, our patients will be happier, the providers will be happier, the workplace will be more pleasant and happier for everyone. It's a win-win.